Good morning, welcome back, and as we promised you in the beginning, we are going to be discussing a nutrition issue for this morning. We're going to talk about obesity and the causes of obesity and how we could avoid obesity. We're pleased to be joined this morning by Dr. Munir Williams, who is a plastic surgeon and nutrition expert. Good morning.
Good morning.
How are you?
Good morning, Dr. William. And first of all, we need to know what exactly is the definition of obesity, because sometimes people are very obsessed with their weight so that they think that they are obese, but they're not.
Okay, obesity is just accumulation of fat and adipose tissue in certain areas in the body by a ratio about 15% or more of the normal age, sex, and race. The corresponding age is from standard tables. There are standard tables related to age, standard tables related to sex, standard tables related to race. And from these tables you can find my age is 23 years, my height is something, and so my weight must be so. This is the obesity. But we have to differentiate between accumulation of fat and adipose tissue and accumulation of fluids, which is called edema. Also edema, there is increase in the body weight due to accumulation of fluids inside the body. But there are different causes related to edema. Edema may be related to the heart, there are cardiac causes, or may be related to the liver, there is hepatic causes, or even may be related to the kidney, there is kidney or renal causes. But obviously there is a different entity. There are different causes related to obesity. For example, there is genetic cause. We find there is a gene related to chromosome number 17. This is proved in the last 10 years to be a main cause of genetic obesity. This is number one. Number two, you can find endocrinal causes. For example, decrease in the function of the thyroid gland in the neck, or the decrease in the function of the pituitary gland in the base of the skull. These do mainly lead to appearance of certain types of obesity. Also, number three, there is what is known as metabolic causes, such as metabolic disease, such as diabetes. We can find diabetic patients. About 75% of patients who are suffering from diabetes are suffering also from obesity. And here we find metabolic causes. Also, you can find number four, what is known as psychic causes. We can find person says, when I become angry, I eat more. And here lies a psychic element. Once you are depressed, once you are angry, you are eating more. And here there is a hidden cause for obesity.
Most of the women are like that.
Women and depressed men also in these times. Also, finally, you can find the bad habits in eating. For example, we eat during watching TV or hearing radios or reading a newspaper. And as you see, this is lovely, and this is one of the main causes for obesity. So we have to differentiate between accumulation of fat, which is obesity, and the accumulation of fluids, which is edema.
Does obesity automatically equal healthiness?
Of course. This is a disease of this century. And every person can say, I am obese or not, by a simple calculation which is known as mass number. I can say mass number is just a ratio, it is a number. It is a division between body weight in kilograms divided by square of length in meter. For example, suppose you are 60 kilograms, and suppose your height is 1.6 meter. So your mass number is 60 divided by 1.6 square. Here comes the mass number.
1.6 squared?
Square, yes, 1.6 times 1.6.
Okay, and then?
Okay, and then this is the mass number. This number, if it is 15, this is not obesity, it is senility. If it is from 15 to 20, this is mild obesity. If it is this mass number from 20 to 25, this is a moderate obesity. From 25 to 35, this is severe obesity. More than 40, this is a morbid obesity. So by a simple calculation, every person can calculate what is the distance between him and obesity, and which type of obesity he is. He is mild obesity, moderate, severe, or morbid, and so on. Yes.
Right. I guess Reem is calculating.
What's the normal one?
So what did you come up
with? The normal is 20, but 15 is senility.
Oh.
And of course, I'd like to remind you by a simple point. Obesity, as we said, it is accumulation of fat. There are two different ways for fat behavior. either the fat cells increase in number, and this is called hyperplastic obesity, in which we find the person is obese, okay, but there is increase in number of fat cells. And this type is usually present in infants and in children before puberty. The second type of obesity, there is also increase in number of fat cells, but these fat cells, there is increase in size. And here we find the number of fat cells is standard, but there is increase in the size of fat cells. And this type of obesity occurs after puberty. So there are two types of obesity: hyperplastic, which increase in number before puberty, and hypertrophic, with increase in size, which is after puberty. And this leads us later in treatment of obesity to speak about, is liposuction good for infants or
I was
not?
going to ask you that.
So it is not good for infants because there is increase in size. So it is forbidden and never to be done before puberty, liposuction, and so on. So the behavior of division of fat cells, whether increase in size or increase in number, is very important for us in treatment of obesity. Okay.
But also, besides the liposuction and everything, not every person is a good candidate for liposuction. And some people who, even if they undergo a certain diet, whatever diets they might take or they might undergo, it might not work because it might be thyroid, problems, or disease problems that might cause to obesity. So in that case, what would the person do?
Of course, to start the treatment of obesity, from my own opinion, at first we have to do many investigations in order to see that this obesity is normal obesity and not related to any change which occur. And then once if we diagnose any cause, of course, we have to treat the cause. For example, if there is cause related to the thyroid gland, so we have to treat the cause which is related to thyroid gland and give treatment for thyroid gland and so on. If there is cause related to any other causes, we have to treat the cause and so on. So if the cause related to any cause, it has to be treated. But suppose that we have normal obesity. In this type,
If it's normal, then it's a proper diet.
Yes, my own line of treatment passes in three ways. First way is diet control. The second way is exercise, and third way is goodwill. To start with is diet control. Of course, diet control is very important because diet control, we have to do something related to the diet. At first, diet, we have to forbid certain types of fries. Number two, we have to calculate. Every person has to calculate. From my own point of view, I don't forbid any type of diet. I say to any person, you have to eat everything you want to eat. But you have to calculate your calories today. Suppose you are going to do hard work, you have to do your body weight and multiply it by 40. So this is a total number of calories today. If you are
your body weight in kilograms or
in kilograms,
pounds?
yes.
Okay, in
Suppose
kilograms.
that you are your body weight is 60 kilograms, and today you are going to do hard work. So you have to multiply 60 by 40. So it is 2,400. These are the total number of calories today you have to eat today.
Okay.
If you are going to do moderate exercise, you have to multiply by 37. If you are going to do less exercise, you have to multiply by 34. So you have to take certain types of calories to be eating for this day. You can take everything, you can eat everything, but the total amount of calories is what you have calculated. The second line of treatment refers to for exercise. Of course, I like exercise because exercise makes fat is the only source or the main source of energy. Number two, exercise leads precipitation of fats and walls of capillaries is less, and this prevents atherosclerosis, cardiac problems, and cephalic problems, and so on. Also, fats, the relation to sports, may prevent precipitation of fats in the muscles, and this makes the person very good and very strong. So the first line is diet control, the second line is sport control, and the third line, there must be a will. You have to control your diet and your sport. Otherwise, there is a rule of surgery, of course. And of course, surgery passes in many lines of treatment.
What are the types? If lastly, we could take a look at the types of surgery, and if it's dangerous for some people to undergo surgery of liposuction, for example.
At first, there is nothing dangerous to be done if it is done against the normal rules. But in brief, we can say that we can divide surgery into three types. If there is mild obesity, the main surgery is liposuction, because liposuction is an operation for contour. It is not for decreased body weight, but it is for contour of the body. If there is moderate obesity, such as pendulous abdomen, there are 3 operations to be done at the same time. The first is liposuction of the anterior abdominal wall. The second is duplication of recti muscles in order to strengthen the abdominal wall. The third is dermolipectomy of the remaining part of the abdomen. This is done for the moderate obesity. For severe obesity, we have to do one of two. Either to perform gastric restriction in order to decrease the amount of the stomach, either from inside by application of balloon, or outside by application of a ring, or in between by gastric strip ring. Or in the second way, we have to do what is known as intestinal malabsorption. By any operation, either to remove part of the intestine, or gastroduodenostomy, or ileoduodenostomy, all together to decrease the amount of the absorbed food inside the body. So in brief, either liposuction for mild, or dermolipectomy for moderate, or gastric stripping, or intestinal absorption for severe cases of obesity.
But of course, this is the last line of treatment. You would first try the diet and exercise.
Diet, exercise, and good will.
You have to have the will to do that.
Have the will to continue this for life.
Absolutely.
Right. Dr. Munir William, Professor of Plastic Surgery, would like to thank you very much as usual for your very valuable tips. And thank you very much for coming.
Thank you very much.
And right now we're going to go to a brief report about the Ministry of Youth, who has recently signed a protocol with Euromed countries to enhance understanding and peace, understanding of peace among cultures throughout the bridge of youth, who are the future of the nation. We're going to go to this report. I'll be right back.